Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics today, including some recent advances in treating cancer and some news about childhood health. But before we get there, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is the text for today's video. You can go there for free, subscribe for free, of course, and in the newsletter, what you'll find are all of the links to the scientific studies and actions and background material, as well as a lot of medical references you may find useful. So let's get started. Copper deprivation causes cancer cells to die. This was actually a really cool story. Now, toxic in high concentration, copper is actually essential to life, but as a trace element, so we need very little of it. Many tumors require significantly more copper, though, than healthy cells because they grow. And a possible new point of attack for cancer treatment is to limit their access to copper. Medical researchers have now introduced a novel method by which copper is effectively removed from the tumor cells, and that kills the cells. Because cancer cells grow and multiply so much more rapidly than the cells around them, they have a higher need for copper ions. Restricting their access is this new therapeutic technique. The problem is that so far it's not been possible to develop drugs that bind copper ions with sufficient affinity to take them away from the copper binding biomolecules. Now, in cooperation with Stanford University School of Medicine and the Goethe University in Frankfurt am Main in Germany, Tanja Weil, the director of the Max Planck Institute for Polymer Research, that's in Mainz, and her team have now successfully developed such a system. And at the heart of the system are the copper binding domains of the chaperone ATOX1. This is in case you're in that business. The team attached a component to this peptide that promotes its uptake into tumor cells. An additional component ensures that the individual peptide molecules aggregate into nanofibers once they're inside the tumor cells. In this form, the fiber surfaces have many copper binding sites in the right spatial orientation to be able to grasp copper ions from three sides with thiol groups. Those are chelate complexes. The affinity of these nanofibers for copper is so high that they also grab onto copper ions in the presence of copper binding biomolecules. This drains the copper pools in the cells and deactivates the biomolecules that require copper. As a consequence, the redox equilibrium of the tumor cell is disturbed, leading to an increase in oxidative stress, and that kills the tumor cell. Woohoo! In experiments carried out on cell cultures under special conditions, 85% of a breast cancer cell culture died off after 3 days in 72 hours, while no cytotoxicity was observed for the healthy cell culture. This is published by Wiley. There is a link to it in the newsletter. Watch this space. This is a super cool way to treat cancer. I want to talk briefly now about recycling pacemakers. Let me go off script for just a moment and tell you that medical devices in the United States generally don't recycle into people. They recycle typically into animals, okay? They're generally not thrown away. Now, let's talk about pacemakers. There was a randomized trial conducted by the University of Michigan that compared previously used and new pacemakers in patients. And they found that the reconditioned devices were just as safe and effective as the new pacemakers, potentially offering affordable options for patients in low and middle income countries. This was the finding of the late-breaking science that was presented at the American Heart Association in their November 2024 meeting. I think it was just last week, around the 18th of November. Reusing pacemakers, however, is prohibited in the United States, but the U.S. Food and Drug Administration allows re-sterilized devices to be exported for reuse. We can think about the ethics of that rule later, but it doesn't sound right to me. Pacemakers were recovered from corpses from deceased patients and from patients undergoing surgery that required the removal of the existing devices. Pacemakers with at least 6 years of battery life and proper electrical function were re-sterilized for reuse. The researchers concluded that reconditioned pacemakers were comparable to new in terms of safety and effectiveness after 90 days of implementation. So how about recycling them in the US? I think there's a need here, especially in people who can't quite afford new ones. What do you think? Let's talk about money again in healthcare. This was just a shocker to me. Andrew Whitty, you may not know him, but he is the CEO of United Healthcare, which is a just gigantic healthcare company. Anyway, that's an insurance company. Last year, he made, want to guess? I'll tell you, $21 million. How much is $21 million? Well, figuring he works probably a little bit more than the standard 2,000 hours a year, he makes about $8,000 an hour. How long does it take him to make as much as medical providers do in a year? If you're a medical assistant, get this, 5 hours. If you're a lab tech, 8 hours. If you're a registered nurse, he makes as much as you do in a year in a day and a half. If you're a doctor, it takes him less than a week. If you're president of the United States, a little bit more than a week. Just think about it, because our whole system is upside down, paying companies exorbitant amounts instead of paying for healthcare. Okay, just put that away. Let's talk about healthcare for children and families. This is actually a scientific report that came out very recently. According to the National Academies of Science, Engineering, and Medicine, investments in children and families improve child and adolescent health, but also population health, health equity, education outcomes, workforce productivity, and cost effectiveness in public spending. All you got to do is get the kids taken care of. Despite recent advances in the science of early childhood and other scientific and technological innovations, from early detection to new treatments, children face increasing rates of chronic diseases, obesity, and mental health challenges. So it's not working. The U.S. currently ranks at the bottom among wealthy nations on the mental well-being, physical health, academic, and social skills of children. This is from the report. You can download, it's not a short report, it's long. It's 480 pages. I downloaded it. I have a link to it in the newsletter. It's free because we the people pay for this. Anyway, the committee identified 5 implementation goals to set the country on a path toward improved health care and better health and well-being for children and youth. Each goal includes a set of recommendations aimed at critical federal, state, and community level actions. I'll give you the high-level summary. If you're super interested, download the report. It's in Chapter 10. Elevate the importance of child and adolescent health for the nation through continuous public focus on children and youth, and there are a lot of programs to do that. Finance healthcare systems for all children, emphasize all children, did you hear that? Emphasizing prevention and health promotion. Strengthen community level health promotion and disease prevention, make sure everybody gets vaccinated and is aware of illnesses. Ensure co-creation and co-design of programs and structures with youth, family, and community voices and leadership. That actually helps in the uptake of advice if you have, from the bottom up, understanding and trust in the organizations. Implement measurement and accountability to ensure equitable achievement of these goals. You know what? I used to be an engineer, and if you can't measure it, it pretty much doesn't exist. So here you want to measure to make sure you're doing the right thing, and then hold organizations accountable for results. And then fix as needed, right? Anyway, the report's recommendations call for sustained and coordinated leadership at the federal level to to maintain focus on children and youth and their health care and better assess the child health impact of public policies. Okay, again, Chapter 10 has detailed recommendations. If every child had access to health care without worrying about copays or deductibles, guess what? We would be well along the way. It wouldn't implement everything, but well along the way to solving the problem. It's not really feasible to have universal health care for only the under 19-year-old crowd. It doesn't work that way. You need a wide population to make it work. So how about we just have universal health care and include all of us? We're sure to sweep up all the kids in that. All right, anyway, let's let Congress know about this report so they can see how important it is, and maybe they can implement reforms that will help children and families in public health. This is really in their court, and we can let them know we want them to do it. Here's the action. Let's let our senators and members of Congress know about this deplorable situation. Remember, we're at the bottom. Here's a link for their contact information. It's in the newsletter, or I will also include it in the YouTube description box. Or you can use ResistBot, my favorite. You send a text message on your cell phone to 50409. Here's the message. Sign, S-I-G-N, space, PVWAYG, sign, space, PVWAYG to 50409. I'll read you the email that your member of Congress and senators will get. I'm your constituent, and I want you to know about a new report published by the National Academies of Science, Engineering, and Medicine. It's called Launching Lifelong Health by Improving Healthcare for Children, Youth, and Families. There's a link to the report, all spelled out, for their staff so they can go and get it and read it. The reason it is important is that despite recent advances in the science of early childhood and in other scientific and technological innovations, from early detection to new treatments, children are facing increasing rates of chronic disease, obesity, and mental health challenges. The U.S. ranks at the bottom among wealthy nations on mental well-being, physical health, academic, and social skills of children. Go to Chapter 10 of this report for detailed information on how to repair the situation. But let me point out that access to health care without worry about copays, deductibles, and excessive premiums would go a long way towards fixing this problem. Well, that's called universal health care, and you can make it a reality and help our nation's children. They're the future for all of us, so take care and protect them. That's what I've got for you today. Down below, there's a like, a share, a subscribe button. Go subscribe to the newsletter, Healthcare Advocacy. You can send me comments and suggestions for research here or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.